name is Kelly Connor, and I'm going to be teaching you some laboratory procedures, collections, how to process them for an everyday diagnostics for a veterinary clinic. This is for Class V THT 2331-33420, Veterinary Clinical Path 2. Okay, so we're going to show you how to properly clean your chemistry analyzer, and this is going to be the IDEX chemistry analyzer. You always want to have your gloves on, preferably non-powdered. You don't want to leave any residue when you're cleaning the analyzer itself and the discs that are in there. So have that available. You always want to use like a rubbing alcohol pad. IDEX sends these out themselves for us to use. They are very small, so we tend to kind of use them pretty frequently. So you want to just, you clean the outside, you clean the screen. You want to go to Tools. You'll see where it says Clean Analyzer. You can go ahead and hit that. Then you're going to get this down, and it brings up the elevator doors. And you take your little wipey, and you just wipe all around there. You want to make sure you get all the nooks and the crannies, all where any dust can get up in there. And where you put your samples, which they're going to have, in this particular analyzer, they're going to have these on top of where you put your sample in. So you take those out. You just clean those real good. Just clean all around them. Clean all in the nooks and the crannies. Again, they like you to use the alcohol wipe so it doesn't leave any residue. It picks up all the dust and everything, and it dries quickly. So you just keep using them. If they get a little dusty or dirty, just get another one. Clean all that. Whatever you can take out, you take out, you clean. You'll see a little bit of dirt and dust in it. Just clean that out. Wipe that out real good. Then you are going to go where the discs are, which is very important to clean because they get pretty dirty. And wipe that down, or your analyzer is going to come back with either some error messages or not going to come out properly. So you want to lift your little carousel here where you put your samples out, and this is where your disc carousel are. So these are all the little tiny discs and everything, and you just want to kind of just wipe them out. Make sure they're all wiped clean. And then they have these little sliders right here. You want to make sure you kind of go through and make sure that each one of them slide out properly. You don't have any that's getting stuck. That's going to mess up your results as well. So you just go around your carousel, make sure they all slide out properly. And they're working properly. Then you have where the carousel sits at. You have these two little areas that you need to clean really good. So if you have any error messages, or if you're having, some messages or your results are a little off, clean those. Those can get dusty and nasty, and they can really get your results off. So once you got that cleaned, you put your carousel back in. You want to make sure it's in all the way. You hear it kind of snap. You put your little, where we put the samples in, you put that back. You put your little black holders back. You're just going to put your little elevators back down, close that up. Now to clean out the trash where the discs come out, you're just going to take your little slide that out, throw that out. Make sure there's nothing stuck in there, because sometimes those clips can get stuck. It's going to tell you if it's empty, yes, and just click done. Now it's going to analyze, and you know, different machines take a little bit longer than others. Probably this machine, it will analyze for about 10 minutes or so. And it will just go through all the lines and all the places and make sure everything's cleaned out and everything. So we do quality control usually about once a month or so. And it's real easy to do. You have the 2 conjugates, the dilution and the conjugate. These are going to be in the freezer. You're going to have a quality control clip and a light clip. These are going to be in the freezer as well. This again is going to be the IDEX machine. So some of the other different ones like Abaxis have discs and everything. So when you take these out of the freezer, they need to be left out for an hour. Once they have stayed out for an hour, you need to lift up with the pipette. A 300 milliliter pipette and lift that out of the dilution and put it into the solution. No, I'm sorry, 3 milliliters. So you're going to take a normal syringe and you can syringe it up and then put it in the solution. Then once that's mixed, you don't want to shake it up or anything, you just want to roll it. Make sure you mix it up real good. Leave that out for another hour. Once that has settled, is left out, then you take your pipette, the 300 milliliter pipette. You get your little tip here, you syringe it out, and you're going to come over here and you'll get one of the plasma containers. You syringe it in there, you make sure it's to the line, just like you would be running a chemistry. You're going to put a light in first, and then you're going to put the quality control in on top of that. Once you have that, it's going to analyze it like a regular sample. Then it's going to come out and print you out a little handout like this. Now here in this particular one, we just did this, it was a little off, but we do not have this clip, so we do not use the NH3, so it's going to be a little off. So once we do it again next month, we're going to double check and make sure that's in the correct place. So make sure it's all in the middle, in the black here. If it's going to be lower or higher, then you may want to call your company and see if there's anything that you need to do. So that's a simple, easy way to make sure you clean your analyzer, you clean it, and you do a quality control at least once a month. You want to clean it at least once a week, if not more. Okay, so we're going to use Roscoe here, and we're going to do a heartworm test. You want to use one of the small needles, and then you have the EDA tube to put your blood sample in. It's okay, Roscoe. Just going to use the cephalic vein. Get your blood sample. Alright, and then we're going to come over here and we're going to put it in our machine. So what you're going to do is, you know, we've got Cornerstone here on the computer. I'm just going to go ahead, go through the lab request, hit the doctor, and we're going to do the SNAP 4DX Plus. That's going to send it over here to the IDEX lab machine. We're going to highlight it. We're going to hit run. We're going to hit the Snapshot DX. Hit run. That's going to send it us over here to the snapshot. Highlight that. Hit select. We have the 4DX Plus, whole blood. You can also use plasma or serum. Hit next. So our machine is all ready. We're going to get one of our snap tests. Alright, we've got our conjugate right here. We're going to get our little tube. Now we're going to do 4 drops of conjugate and 3 drops of our blood. So each test comes with a little pipette. That's what you want to use. 1, 2, 3. Just mix it up a little bit. Alright, and then we're going to put our sample right up here. We're going to watch our blood go down the screen here. And you want to make sure your whole screen is covered with the blood sample. You can actually even go ahead and wait until it starts, just barely start coming out to this little round circle down there at the bottom. Sometimes it can take a little time, sometimes it runs a little quickly. Make sure your whole screen is covered. Alright, our whole screen is covered. You can see no white marks on there. We'd go ahead and push this down. Alright. And then we just insert it right in here into the snapshot. Then it's going to process it. And then it's going to count down right here. So you got 8 minutes for this to process, to kind of incubate. And then the results will come out on the computer. So I can show you here on an old client what the results can look like. It's going to print out. And the 4DX Plus is going to give you the anaplasma, the Ehrlichia, the heartworm, and the Lyme disease. So it tests for all 4 of these tick-borne diseases. And that's what the results look like. This particular animal is positive for Ehrlichia. So that way you can go through this with the client. You can tell them, you know, make sure that your dogs and cats are on a flea and tick preventative. Alright, so we're going to be doing fecal flotations. There's going to be 4 different types of fecal sedimentation that you can do. We're going to do just the regular fecal flotation with the fecal solution. So what you're going to do, you're going to get a good sample of your fecal. You've got a little cup here. You're going to put a little bit of your fecal solution into the cup and just put your sample in your cup and get it all nice in there so you can get a good sample. Okay, you can mix it up a little bit. Alright, so here you want to get your cover slip ready. And you want to pour in your fecal solution, and you want to make a little meniscus at the top, which means you kind of get it into where there's a nice little round shape to the top of it. And then you're just going to put your cover slip right on top of that. Now usually you want to kind of have this set for about 10 or 15 minutes, so we're going to let that set. Next, we're going to do the fecal flotation with the centrifuge with the centrifuge. Now each place may have different fecal tubes here. This one we're going to use a StatSpin oval tube. So you want to get a good amount of sample, about 2 cc's of sample, 2 grams. And I've just got, you know, a nice big sample in this bag, and I'll just get some out. And for the centrifuge, you want to mix it into a cup with your fecal solution. So I'm just going to show you here, because I actually have one already prepared. You're going to mix in a nice amount of fecal solution in that, and just mix it up real good. You just want to mix it up real good. Alright, and then once you got it mixed up, you can take either a cotton gauze, or a filter. So here we're going to use a filter, and you're just going to strain it into another cup, because it's going to be kind of hard to put it into the fecal tube. So what we'll do for this particular fecal tube, it says you need to fill it to this line right here, and then we're going to put in this little filtration, and you put that in here, and you turn it, you know, most of the way, not all the way, and then you're going to fill it again until about this line, and then we're going to centrifuge it for about 5 minutes. You want to keep it, you know, uncovered and everything without the cover slip. Then you take it out, you're going to twist it all the way down, and your liquid's going to come up to the top. Again, you want a meniscus at the top of here and put your cover slip on there, and then you want to sit and wait for about 10-15 minutes with that. So here I've got one already set up that's been sitting. I'm going to get my slide here. I'm going to take it off the slide, and we're going to check it out underneath the microscope. So here you want to have it on the 10x power, and everybody's perception is going to be a little bit different, so you want to kind of adjust it to where you can see the best that's floating on top of the water here. Now I'm going to start by the corners. It's up to you whether or not where you want to start, but I always start at the corner, and then I go vertically up and down all the way across my cover slip. Some people like to do horizontal. That's fine as long as you've covered the whole cover slip. I'm looking for any parasitic worms, like hookworms, roundworms, tapeworms, any intestinal parasites. Which right now I'm just finding a whole lot of pollen. It's pollen season, so you'll see a whole lot of pollen coming out in the fecal. So I'm just going up and down all the way across. Not seeing any worms yet. So you'll sometimes see leaves, you'll see fecal matter. I've seen fleas or mites in a fecal. So you always have to look carefully. You know, there might be some bubbles in there or some trash, you know, depending on what they've ate. Just wing through all that, look for your worms. Alright, I didn't see anything, looked negative. So that's one type of fecal that we have. Alright, so that's still running, so we still have a few minutes on the first fecal flotation. Now the direct smear is real easy. You just want to take your slide. We'll get your slide. You just want to put like a drop or two of fecal solution on there. And then you take and you get you a sample of your fecal. There's a lot of grass and twigs in this one. Alright, you want to do about the same amount. You're going to put it on there as best as you can. And just mix it real good. You want to have a homogeneous mixture there. And you can take off the big chunks. You don't need those in there. Mix it up real good. Have a nice thin layer so you can see through it. I'm just going to take out some of those big chunks right there. Okay, and then I'm going to put a cover slip over this. And then we just look under the microscope. This is a good way to kind of look at the parasite Giardia. You normally don't see that with the normal fecal flotation. Again, we're going under 10x. We're just going to look through the microscope, just your fine adjustable knob. Again, I'm going to find my corner. And go up and down. This one sometimes is kind of hard to see through a lot of the trash and the chunks and stuff. That's why you need to make sure you really mix it real well. So we just finished up the direct smear. I didn't see any worms or anything in there, so all that was negative as well. Alright. So next we're going to go back to our fecal flotation. It should be about time. So we're just going to get our slide. Check this out. Check underneath the microscope. Same way, under 10x power. Start in a corner and go up and down. Go find my corner. The only thing I see out of these fecals coming from this animal is a lot of pollen, some grass. Not much going on. When you're first starting out, you want to take your time. Just go up and down because you may miss something. But once you get a hang of it and figure out what exactly you're looking for, you can usually go pretty quickly. Alright, and I'm at the end of this one. Again, it's negative. And you just want to throw them in the trash. Alright, so lastly we're going to do the sedimentation. This one you want to mix about 2 grams of feces with just regular tap water. You can mix it in a cup or a beaker. And then you want to take a gauze and set it on top of that, and then put it in another cup. So here I'm just going to show you. We're just gonna filter that through the gauze. Then you've got your feces here. And so I've already done this, and you want to go ahead and put this in our centrifuge tube, and mix it in the centrifuge for about 5 minutes, which I've already done. So you'll see the sediment down there at the bottom. So what you want to do after that, you can either centrifuge it or you can just let it sit there for about 30 minutes and all the sediment will go to the bottom. So now what we need is just to pipette some of that fecal solution out the top and put it on a slide. You want to make sure that you get off the top and not where the sediment is. All those eggs and everything is going to float to the top. So you can just take a drop or whatnot, place it on your slide, and then place a cover slip on top of that. And then we're going to check underneath the microscope. This one's pretty typical for any large animals or whatnot. The direct smear fecal, a lot of the exotic animals and the exotic vets do the direct smear. So then again, we're just going to check under the microscope, use the corner, go up and down looking for any parasitic worms. Not much going on this one. Again, this is what we typically use, a large animal. So they have a little bit different types of eggs that you would have to look for, like strong jaws or things like that. So again, didn't see anything on this one negative. We're just going to throw it away. There's going to be your top 4 ways that you can take a fecal sample and look under a microscope for any parasitic worms or anything like that. Alright, so we're going to do a senior wellness on this particular dog. We've got enough blood from a jugular stick. I'm going to do a CBC. Fill that up first. I'm going to introvert it a couple of times. I'm going to use a whole blood separator. So we're just going to fill it up to that first line that we get to. Right to that line. And then we also are doing a heartworm test. Alright, so again we're going to go through Cornerstone. We're going to go and hit lab request. Hit the doctor we're doing under. Oh, come on. I didn't want to do that. Okay, there we go. Alright, we're going to go under Senior Wellness, which includes the CBC, the Chem 15, and a light. And then we're also doing a heartworm test. So to get ready for your chemistry, I'm going to swirl our whole blood separate a little bit. We're going to go to the freezer and get the chemistry clips. I'm going to do a Chem 15. I'm going to get a light clip. always stay in the freezer. Alright, so I'm just going to get ready for our CBC here. Always introvert it again before you put it into your analyzer. Again, select your client that you're doing. I'm going to hit laser sight, the catalyst, and the snapshot. We're getting all three. So all that's running. We're going to come over here to the chemistry. We're going to hit our patient here. We're doing whole blood, so we're going to do whole blood, and we're going to hit next. A little elevator door is going to come open. We're going to put our sample in. Then we're going to put our clips in. You always want to put your lights on the bottom, unless you're doing a T4 test. And then we're putting the chemistry 15 in there. Make sure it's all in there. Then we're going to hit run. Now it's going to analyze. It's going to process that sample. And then it will have a countdown clock here in just a second, and I'll let you know how long. Still processing. Let you know that the dilution is being used again for processing. And this test always looks at the internal organs, the liver values, the kidney values, the glucose. Alright, now that's going to have to go process for over 7 minutes. That's going to count down. I'm going to pause here. And then okay, so I'm going to do an ear cytology. I've already put my sample on an ear swab, and I've already labeled the left and the right on my slide. So I'm just going to roll the sample onto the slide. That's my left ear. And that's my right ear. So I've got it adhered to my slide. I'm going to fix the slide, which you simply just take a lighter, hold it underneath of the slide, and this fixes the slide so the ear sample will stick to the slide a little bit better. Just going to wipe down the bottom. And we're going to use our 3-step dye method. Alright, so we're going to dip our slide ten times into each dye. Then we're just going to wash this off underneath the faucet, and then I'll let it dry. And then okay. So I let the ear cytology dry. You want to kind of make sure it's dry enough so it doesn't, the water droplets interfere with your reading of your cytology. So I always start off with the 10X, and I'll get it to where it's focused in on it, and then I will move it to the 40X so I can see any of the bacteria in there. And we're looking for any yeast, we're looking for any rods or cocci as far as bacteria goes. So I'm just going to focus in, and then I'm going to go ahead and change over to 40X and then refocus. That way you can see the bacteria better. This is an ear cytology from a beagle that usually has infections in her ears. So I'm just checking over and make sure everything looks good. And you're going to see, epithelial cells. You're going to see if they have any pustules or any bleeding or anything. You'll see some of the red blood cells. If they have a real bad infection, sometimes you'll see some leukocytes. Just looking all around, looking at the left ear and the right ear. Nothing too bad. I see a little bit of cocci, nothing overgrowth. I mean, you're automatically going to see a little bit of cocci usually in an ear cytology. Maybe 1 or 2 yeasts, but nothing too bad. Doesn't look like it's bothering her too much now. But usually the yeast is going to look kind of like a footprint, or I've heard it look like a snowman as well. Rods are going to be, rod shaped. They're going to be small. You're going to see probably many of them in one section. And then same with the cocci. You're going to see if it's an overgrowth, they're going to be little teeny weeny little dots. But you'll see a whole bunch of them hanging out in one area, bunched up together if it's real bad. But looking through hers, I don't see anything too outstanding. to where it would need to have some type of medication. So you just look through and just let the vet know exactly what you see. And then they'll kind of determine what kind of medication or drops or whatnot needs to go in the animal's ears. And that's pretty much it. A little drawing of some of what the bacteria will look like.
First, you begin the necropsy by observing the outside of the animal for any signs of disease, including trauma. That might help you gain information about the cause of death. Next, place the animal in dorsal recumbency and make a ventral midline incision. Begin opening through the skin. Extend through the muscle layer. Careful not to disturb any of the organs. Open both the abdominal and thoracic cavities. Begin by making a visual assessment of the organs and their location in the body before any manipulation. Evaluate any effusions. Decide if they are indicative of pre or post-mortem change for both the thoracic and the abdominal cavities. Best to examine in a systematic approach, beginning either with organ systems or beginning at cranial and moving caudal aspects. Any tissue is thought to be abnormal. Consider sampling for histopath. Common organs would include the liver, so we'll take a sample of our liver. Pathologists always prefer the distal lobar areas. Handle it gently so you don't manipulate the tissue. Place it in formalin. No obvious gross abnormalities are found in this patient, so we'll probably be relying on histopath for the cause of death. Other organs include lungs or heart, so we'll submit the heart for this patient. Oftentimes, only a small piece of the organ is submitted, but since this patient is very small, we will submit the entire heart. Okay?
And you want to make sure that you went ahead and label your specimen cups with the name of the patient, the name of the owner, their number, age, date of birth, species, and then we'll fill out paperwork to send off to the lab. So to take care of a rabies specimen, to collect it or whatnot, you first want to call the state health department just as a consult, and then get their input, and then you can schedule a pickup or whatnot. The people who need to handle the potential rabies specimen would be a veterinarian, a doctor, a state lab technician. Those are the type of people that will take care of that. Usually if we are thinking that this animal has rabies or whatever, we usually need to spare their brain or just cut their head off after death, and then you just wrap it up and either freeze it so then the lab technician can come and pick it up, and they travel and transport it in dry ice. Then they'll go ahead and transport it to the lab, and then where they will take a glimpse into the brain, and they'll investigate piece by piece if the brain has any evidence of rabies. Then we usually get the report back within a few days, and depending on the results, you know, it'll let us know whether or not that specimen has rabies. If they did, if another animal was bit or was in contact with them, we usually recommend them be quarantined, usually for about 6 months. Depending on the results, if it comes back negative, then we can, you know, let them decrease that amount of quarantine. But we always want to be, you know, very particular about handling and dealing with rabies specimens. So that's how we usually collect, and we make sure we label it very, very closely, you know, with the name of the owner, the specimen, you know, where it came from, those types of things, so then it does not get confused or mixed up at the lab. So it's very important. So the CDC, you know, they talk with the state lab department as well, and they're all in communication talking about, you know, whether or not we record and keep a track of the rabies in the area. Thank you. Okay, so we're going to start doing a vaginal cytology. We want to just kind of prep the area. Sometimes you can shave around there to get a nice sight of the vaginal area. We're just going to clean that area. We're going to take our swab, which I've already moistened, and we're going to gently just go right into the vulva. You can start just going straight in there. And just swab around in there. Get a nice sample. Alright, and then I'm going to take out. I'm going to prep my slide, which I'm just going to roll right on my slide. And then we're going to stain this slide and look under the microscope to see which stage she is in. Okay, so now we're going to stain the vaginal cytology. Just like with the ear cytology, we're going to stain it with a 3-step dye. We're going to dip it in stain 1. Ten little dips. Then we're staining 2. Then 3. I'm going to gently just wash it off. We just let that dry. So this is actually a spayed female. So she's more than likely going to be in diuresis. We have 4 stages of uresis. We've got anaresis, proresis, eresis, and then diuresis. So next we're just going to look under the microscope. And that's when we look for different cells to figure out which stage they are in. For anaresis, you'll see some intermediate and parabasal cells. They're going to be prominent in the smears. Superficial cells are going to be absent and found in small numbers. You'll see some neutrophils and some red blood cells may not be present during this stage. Then anaresis is the reproductive system's at rest. So you may see no behavioral changes. You may see some discharge, but all that is normal. Proeresis usually lasts about 9 days. That's when you'll see the big amount of discharge. The vulva will be swollen. They may consist to be in the proeresis 2 to 3 weeks. You can see some parabasal, intermediate, superficial epithelial cells. You'll see a shift to all superficial cells. Red blood cells may be large in number. Neutrophils may be seen. And some bacteria could also be seen. This is when the increase in estrogen, the follicles develop, and the uterus is enlarged, the proeresis stage. Eresis is when she is ready to ovulate. The estrogen decreases, the proestrogen increases, the vaginal epithelial becomes hyperedemic, which is, large amount of blood flow to that area. This is where you'll see a lot of the superficial cells, nearly all, and nuclear. Superficial cells are nearly all keratinized. No other cells are seen but superficial cells during this stage. Bacteria are often seen attached to the superficial cells. Neutrophils are absent, and everything. So in our slide, we're probably going to see the diuresis stage, which is when they're at rest. They're no longer in the reproductive stage. We'll see no big difference between diuresis and anaresis. So we'll see a lot of the same cells, superficial cells. A lot of the intermediate and parabasal cells. So we're going to go ahead and take a look under the microscope and see if this is what we see. We'll start off in the 10X, and then I'll move to the 40X, so I can get a real good sense of what kind of cells I'm looking at. Do see some intermediate cells. Alright, and then I do see a few of the parabasal cells. So here is a little picture of what that could look like. Get the parabasal cells and the intermediate cells. We usually do this if we're going to be breeding the animal, looking to see what stage is best for breeding. So a lot of vets don't really use this particular cytology. Alright, so we're going to do a skin scraping. we've got the scalpel here. We want to dull it down. We usually just scrape it across here. Make sure we dull it down. Then I'm going to put a little bit of mineral oil on the slide itself. And then we'll put a little bit on the area that we're scraping. Now you want to find a place that is pretty much hairless, doesn't have a whole lot of hair. Usually if there's like a skin rash or a place that looks a little bit suspicious that we want to do a skin scrape on, that's where we want to do it. You want to kind of just pinch up the skin, and we're going to just scrape down. We want to scrape it just a superficial layer off until you start seeing the slight bleeding of the capillaries. So I'm just going to do a little slight scraping here. Alright, and you'll start to see the little capillaries come up just like that. And that's what we're looking for. Alright, and then we're just going to come over to our slide. And just scrape it onto our slide where that mineral oil is. Alright, and then we're going to look under the microscope. We're looking for any mites, any Demodex, mange, those types of things that could be causing skin irritations. And then also we're looking for some bacteria, yeast, cocci rods, anything that could be causing their skin irritation. So we're going to come over here to the microscope. We're going to use the 10X. Find a little area. You may see some red blood cells. Since we did get a little slight blood from the capillaries, you may see that. Skin cells, epithelial cells, of course you're going to see that. And then we're just going to look through, see if we see any bacteria, see if we see any mites or mange like Demodex. Anything abnormal. Then I'll just like to do a little quick look of the boarding, just to make sure I didn't miss anything. Just about all I see is some epithelial cells and some red blood cells, a little bit of skin debris, some hair follicles. Do not see any abnormal bacteria or any mites or anything like that. And